conclusion of that 7 countries was that what we would accept if you had it. But once you came up to the standard, you didn't have to go and get registered in one of them in order to be registered. That was not the intent of the law.
And I think my concern, sir, is that in 2013, some amendments were made, but there wasn't anything made despite the fact that the issue had been flagged to accommodate what formal process there should be for the Caymanian who finds himself in the position that they are.
Okay, but we would certainly invite you to put that, pass that suggestion up the chain of command and try and help you monitor through the AG's office that it gets done.
Mr. Chair, just through you, in terms of the recommendation, then recommendation number 5 on page 19, and maybe this, I guess maybe this might be for the chief officer. The recommendation is that the government should review the policies and practices and the inspection of healthcare facilities. It should take steps to ensure that all qualified practitioners are appropriately registered. You see the note in the back of in Appendix 2 with regard to that recommendation, and it says review to be completed by end of July 2017, and the responsibility then is Ministry of Health and DHRS. And one of the management responses to that recommendation is that it's difficult to monitor and enforce, which I think you've given adequate reasons why, but it's also due to limited resources was the response. Is it I guess, if you got more resources, it wouldn't necessarily make it easier, given what you've just said in terms of, unless we change the criteria that's there, the definitions that's there, and applied some changes to the overall legislation. Is that fair to say?
I'm not sure whether that appendix is speaking to me having resources or the monitoring.
I think it's the monitoring at the ministry level, I think.
But that is the Ministry of Health, as I understood you to say.
Yeah, that's why I said it might be for the chief officer when I was asking the question.
That would be the Chief Officer of Health, and I'm the Chief Officer of Community Affairs.
But we've been told in several other PAC committees that there is this chief officer meeting that happens on a regular basis. Are these the kind of matters that come up in those management meetings which would lead to this cross concerns being addressed and met?
Mr. Chairman, our first cross-ministerial is where 2 chief officers would sit down and write to each other on the issue, and then that would be brought to the 2 ministers in terms of changes that needs to happen. With the Department of Accounts and Services, we have flagged the waiver, and we've gotten that done. What needs to occur, we have suggested changes that need to go to the health practice law and the health insurance law. And so when the director writes her recommendation to me, the first thing is to sit down with the chief officer, because we're all on the same floor. In terms of chief officers meeting, if it's something that's across that will affect other ministries, we could then bring it across. But it should be that the 2 chief officers are able to sit down, and then both should sit down with their relevant ministers if their legislation changes to be done.
The reason I'm flagging that up is because in response to the recommendations made by the Auditor General, which address some of these concerns, nowhere is it in here suggested that your ministry or children and family services are going to be involved or having a responsibility for it. So I think that we need to ensure that when they are in fact making some of these changes and improving them, that you take the initiative to say, well, here we have caring homes and we have the counseling services that falls under us, and we need to be involved in what you are developing because we want to make sure that our professionals have the opportunity to be licensed and that we can have in place monitoring mechanisms, whether that includes your ministry in being involved in the not only the performance monitoring but also in the quality assurance with reference to the DHRS, which is the Department of Health Regulatory Services. So I think that given where we're at, and you're not identified as one of the areas that will be involved in solving the problems, I would certainly invite you to take the initiative to make sure that your areas get adequately represented when they are coming up with the solutions. Because we don't want a situation to happen where they develop a solution in absentee of you, and when it comes to you, then it's entirely not applicable because of the things that your director of counseling just identified in terms of the various specialties that exist, for want of a better word, within that environment.
Mr. Chairman, I undertake to do so. We, like I said, initially between us and the health services were involved in the discussions about the homes at the CFS, and we'll open the conversation on the Department of Counseling Services. But for the audit purposes, I just got a copy of it when I was called to PAC, so I will follow up afterwards, sir.
Questions for the audit department? When you do a individually, for want of a better word, audit, and you deal with the chief officer and or the deputy governor, it is your expectation that those reports, although they may be specific to a particular ministry, that they are shared across because oftentimes they would be recommendations that it might not be specifically, but knowing of the recommendation could enhance the governance and other structures within the other ones.
Thank you, Mr. Chair. When we are clearing our report, we clear it with our primary contact, and our primary contact is also it's known to them that they are to engage anyone within government who is they're involved with respect to the report. However, and I'll take the opportunity to add, there are references to outside parties here. That is our responsibility. When for example, an organization is mentioned in our reports, and that activities are, specifically related to our findings, then it's our responsibility to do the clearing. But when it's within the government, we do ask that our primary contact, in this case here was the Chief Officer of the Ministry of Health, who we got the data. We actually spoke to some of the people here, but still at the clearance level, it's her responsibility.
Okay. Do you have any questions? Well, thank you all. You get out of jail free card as soon as early. No, thank you all for coming, and we think it is important that we try to, we're talking here about raising the standards and getting things, not only raising the standards and getting things right, but also putting in place matrices and measurements that we can use to determine if we're getting there.
Mr. Chairman, if I could just clarify one point further before you close. I don't want anyone to walk away with an understanding or an impression that the department doesn't have standards in place. In fact, the department has a requirement for clinical supervision to take place to monitor the performance of our staff. I believe that's something that is not a requirement, for example, under the Council for Professions Allied with Medicine. We also have our own code of ethics that the department has to adhere to, the staff have to adhere to, and we have our clinical and administrative procedures that are in place that the staff are expected to adhere to. So I just want to correct those are departmental standards,
Right,
appreciated.
What I'm suggesting is that those are the kind of things that we need to raise up to the level of, so that you will have legislative authority, because you could have difficulties enforcing those, although I'm sure it's included in the contract that they got to follow them and all that sorts of stuff. But if you got reference to a code of law, we might have difficulty for you having things and requiring higher standards that are not necessarily represented in the Department of Health and Regulatory Services, under which you should fall for certain things.
Certainly, and I had addressed the issue of enabling legislation for my department with the chief officer, I think just last week, and suggested that that is something that we need to actually pursue at this time. Our field is growing more complex, and I think that it's time for us to have that in place here, and obviously those kinds of standards would be falling under that.
Sorry, Mr. Chairman, just following up on that. In terms of international best standard, is that the level that these policies are at? And if so, which I see you saying yes, how much communication then between your department and the ministry goes on in terms of devising that or formalizing those best practice goals? I mean, I'm just trying to figure out the two-way communication. If you could just talk to that.
Are you asking about my own ministry or the Ministry of Health? Certainly, I have regular briefings with my chief officer, and I would hasten to say she relies on me because of my expertise to ensure that the policies that I have in place do meet the best practice standards. But we do have dialogue about what is in place, what the expectations are of the staff regularly.
Yeah, our concern there is the appearance of silos, and what we want to find a mechanism where the two ministries, that your chief officer and the chief officer of health, there is more cooperation, coordination, and to make sure that we are in fact putting the right stuff in place.
Certainly, Mr. Chairman, because quite often in other jurisdictions, my services would fall under the Ministry of Health, and so I'm in a bit of an anomalous position where I don't report to the Ministry of Health.
Mr. Chairman, in terms of the legislation, this was the next set of legislation that we think was important to have in place, and so the director has brought it to my attention. And just for the record, the chief officer and myself, and for health and myself, meet regularly, and so I will be meeting with her to address the issues that were brought out today, sir.
Okay. Thank you all very much. You wanted to say something?
Mr. Chair, the following paragraph, 56, talks about inspections in other facilities that are not run directly by government, but obviously do receive possibly government funding. And I was just wondering, in light of the testimony given here today, what their roles and responsibilities are with respect to these facilities, and whether or not the standards and the requirements that are being discussed here, should they follow and be implemented in these facilities as well?
Mr. Chairman, we do give a substantial grant to the Pines, and this policy that's in place for caring homes they were also part of that. As part of receiving their funding through their purchase agreement, they are inspected by DCFS, and before their funding can be released each month, we get an inspection report from the Department of Children and Family Services.
But not from Department of Health Regulatory Services, though.
We are We only have answerability if anything comes up in the LA. For the Pines, it's separate from us. What we do is we bring them in terms of any legislation that we are considering, and this legislation that we're considering for caring homes, the Pines would be very much a part of that.
But I guess what we're suggesting is that maybe you might want to expand the purchase agreement for that funding to say that they also have to be, at some point in time, on some regular basis, be inspected by the health inspectors people if they, because I believe that the Pines would be doing a lot more or just as much in-house medical treatment of their clientele as you would be doing. So we want to make sure that at somewhere along the way, on a regular basis, there is some inspection by the health regulatory authorities to ensure that they have proper protocols in place as well, and that they're not only does it say you must clean the room, it must say that how the room is to be cleaned, and you know, if you go in the room and there's mold growing on the ceiling, you know something's wrong, right? But what I'm saying is we want a matrix, we want a way that you can measure it. If you see where I'm going. Okay?
Mr. Chairman, I've been assured by the director of DCFS this is something that she can start putting in place.
Thank you. Any other questions? All right, thank you all very much. Check and see if the pharmacist that we can start him or if we can get an early evening. For what? This is one of the things you understand what these civil servants have figured out, that if we come to the PAC and we simply look at it and say, well, we started that 6 months ago, there's no way of you knowing whether it was started because it hasn't been going long enough to evaluate it, and then they think they're bailing themselves out. Yeah, I got yesterday a copy of an older person's bill for a law. And it's made up of all of them are running. And this is supposed to be the commission that is going to ensure that elderly is getting adequate service. And every agency that is providing a service to the elderly is sitting on the board. Now, they're not even that. I got written in the law, right? Cover my backside. Committed, that's what that is. because it'll never work. And one of the problems with the HSA board is it is too much involved in management and the actual managing, and rather than being a board and getting the report back and then judging the performance. No. Exactly. Obviously, they have a very comfort relationship with the counselor. No, no, no. We didn't want to call it a celebration, but but preacher, I took it home for my daughter. She enjoyed it. I got a lot of brownie points for that. Yeah. Just make sure that they just check with her that they got the change in the schedule from the 18th to next week Thursday. 9 o'clock in the morning, because I need to know before I adjourn this evening that they won't confirm. We're taking a break.